each and everyone. Before we proceed to our topic, we would like to present a short role play based on a true story by Sean Lester Beltran. Isang araw ay normal lang na nag-e-ensayo si Sean kasama ang kanyang kaibigan nang bigla siya nakaramdam ng sakit sa kanyang braso.
Aray! Uy, Shin! Okay ka lang? Ay, talaga? Tulong! Tulong!
Pansin ito ng kaibigan ni Sean, kaya dali-dali niya itong tinulong at humingi ng saklolo. Kaagad namang pinasuri sa doktor si Sean at dito na nga nalaman ang kanyang sakit.
Kamusta naman po ang kalagayan ng anak ko?
Balita ko po ata kanina na may linya po kayo na cancer sa pamilya.
Opo, yung tatay ko.
Bakit po, Dok? Meron ba akong cancer?
Oo, iho, pasensya na. Bali sa nakita namin ay may bukol ka sa inyong kaliwang braso. Para kami ay makatulong, sana po ay payagan niyo po sana kami ipaputol ang kanyang braso para maibagal ang kanyang tumor o yung cancer po sa kanyang katawan.
Unti-unting nanghihina si Sean at nagpapakita na rin ito ng mga sintomas.
Kumare, may mga bagong band tayo dito at bagay na bagay ito sa mga teenager tulad ng ating anak.
Ay, so, ba't di ko kayo nagpapahinga?
Hindi, okay lang kuya, kaya pa naman namin. Magpahinga ka na muna doon natin anak at carry pa namin ito at kumain ka na.
Sige po, salamat.
Nang nalagas na ang kanyang buhok dahil sa gamot na iniinom, ito ay nahihirapan na at nanghihina na. Nagtangka din itong tapusin ang kanyang buhay, ngunit siya din ay napigilan.
Hindi ko na kaya!
Okay na
Gusto
lang,
ko na pong mamatay!
Ayos ka lang, tiwala lang ha. Magiging successful ang operation mo, tiwala lang. Carry natin to, okay?
Naging matagumpay ang opera ni Sean sa pagputol sa kanyang kaliwang braso na may bukol.
Kuya, kamusta ka na?
Okay lang.
Nahirapan si Sean sa kanyang pagtanggap sa sarili at sa paghilom sa kanyang naranasan.
Ito ang aming new product. Ayaw nga pala, ako ay cancer-free na. Kahit nanibago ang katawan ko sa physical, ako pa rin ay lumaban. Ngayon, ako na ay isang cancer survivor.
Hello fellow classmates and teacher. Today I will be discussing on what is anti-cancer immunity and what are the classification of drugs and their mode of action. So what exactly is anti-cancer immunity? Immunotherapy is a type of cancer treatment that helps your immune system fight cancer. The immune system helps your body fight infections and other diseases. It is made up of white blood cells and organs and tissues of the lymph system. Once again, immunotherapy is a type of biological therapy. What are the classifications of drugs and their mode of action? Signal transduction, also known as cell signaling, is the transmission of molecular signals from a cell's exterior to its interior. Signals received by cells must be transmitted effectively into the cell to ensure an appropriate response. This step is initiated by cell surface receptors. Other components of plasmatic membranes. Intracellular, existing, occurring, or functioning within a cell. Gene therapy. Gene therapy is a medical approach that treats or prevents disease by correcting the underlying genetic problem. Extracellular. situated or occurring outside a cell or the cell of the body. Invasive agents. It is tending to spread prolifically and undesirably or harmful.
What are anti-cancer drugs and how do they work? Anti-neoplastic drugs work by targeting and killing rapidly dividing cancerous cells. So what I is trying to say is that anti-neoplastic drugs are medication that especially target and kill rapidly dividing cancer cells in the body. By focusing on these rapidly dividing cells, these drugs disrupt the cancer ability to grow and spread, ultimately aiding in the treatment of the disease.
What are the classification of anti-cancer drug based on mechanism of action? First, the alkylating agents. The alkylating agents are compounds that react with electron-rich atoms in biologic molecules to form covalent bonds. Traditionally, these two agents are divided into two types: those that react directly with biologic molecules and those that form reactivate intermediate which then reacts with the biologic molecules. Second, the antimetabolites. Antimetabolites are chemotherapy drugs that prevents cancer cells from making more cancer cells or replicating. They trick cancer cells into using the drug instead of molecules it needs to make the genetic material to replicate or DNA. Third, natural product. Vincristine, irinotecan, etoposide, and paclitaxel are examples of plant-derived compounds that are being employed in cancer treatment. 4. Hormones antagonists. A substance that are block the pituitary gland from making hormones called follicle stimulating hormone and luteinizing hormone. In men, this causes the testicle to stop making testosterone. In women, this causes the ovaries to stop making estrogen and progesterone. 5th, miscellaneous. Common miscellaneous agents are asparaginase and hydroxyurea topoisomerase inhibitors prevent realigning of DNA strand and maintain single-strand breaks. Major toxicities occur in the hematopoietic and gastrointestinal systems.
What is another word for anti-cancer? The other words for anti-cancers are anti-neoplastic and anti-tumor. They are called anti-cancers because of the other words for anti-cancer and cancer treatment. For example, anti-tumor is another word for anti-cancer, since tumor is very similarly or if not the same as a cancer, whilst anti-neoplastic is called anti-cancer because of the way it can treat some cancer patients and maybe even help them overcome it.
How do anti-cancer drugs affect the lungs and breathing? The higher the dose, the greater the risk for lungs damage. Hindi laging malinaw kung paano eksaktong nakakaapekto ang ilang gamot sa kanser sa mga baga. Ang ilan ay nagdudulot ng pamamaga ng tissue ng baga. Ito ay tinatawag ding pneumonitis. Minsan ang tissue ng baga ay maaaring maging mas makapal at hindi ganong nababaluktot at ginagawang mas mahirap para sa iyo na huminga. And also, some cancer drugs can change the way your lungs work. The cancer drugs most likely to cause these changes are some example: chemotherapy drugs, targeted cancer drug, immunotherapies, It is not always clear how exactly some cancer drugs affect the lungs. Some cause inflammation of the lungs tissue. This is also called pneumonitis. Sometimes the lungs tissue can get thicker and less flexible and make it harder for you to breathe. This is called pulmonary fibrosis. It may happen gradually over months or years. You may have a cough or feel short of breath or dry. Some cancer drugs may cause you to become breathless when exercising or walking up hills or upstairs. Your doctor will check your lungs if the drugs you are having may cause lungs problem. They will do so during your treatment and afterwards. In some situations, your doctor may have to stop your treatment if the cancer drug causes you to have several lungs problems. To relieve symptoms, they may treat you with combination of oxygen, inhalants, steroids. Let your doctor or nurse know if you feel breathless. Hi, I am Princess Nicole M. Mega from Group 4. Our topic about describe the properties, mode of action, and effect of anti-cancer drugs. And thank you.
What are the common side effects of anti-cancer drugs? Here are the side effects of cancer treatment. Anemia. Anemia is a condition in which the body does not have enough healthy red blood cells. Red blood cells provide oxygen to body tissues. Appetite loss. A loss of appetite occurs when you don't feel hungry or have the desire to eat food. This could cause you to feel full, not enjoy the taste, sight, or smell of food. Food aversion. Not want to have meals with others. Bleeding and bruising. Thrombocytopenia. When your platelet count is low, you may bruise or bleed a lot or very easily and have tiny purple or red spots on your skin. This condition is called thrombocytopenia. It is important to tell your doctor or nurse if you notice any of these changes. Constipation. Constipation is a condition in which a person has uncomfortable or infrequent bowel movements. Generally, a person is considered to be constipated when bowel movements result in passage of small amounts of hard, dry stool, usually fewer than 3 times a week. Delirium. Delirium is a worsening or change in a person's mental state that happens suddenly over 1 to 2 days. The person may become confused or be more confused than usual, or they may become sleepy and drowsy. Diarrhea. A diarrhea is passing loose watery stools 3 or more times a day. People with diarrhea may also have one or more of the following symptoms: an urgent need to use the bathroom, cramping, loss of control of bowel movement. Edema. Edema is swelling caused by too much fluid trapped in the body's tissues. Edema can affect any part of the body, but it's more likely to show up in the legs and feet. Medicines and pregnancy can cause edema. Fatigue. Fatigue is a feeling of constant tiredness or weakness and can be physical, mental, or a combination of both. It can affect anyone, and most adults will experience fatigue at some point in their life. Each year, around 1.5 million Australians see their doctor about fatigue.
Many people who have had cancer treatment have a risk of developing long-term side effects. These side effects can happen months or years after treatment. Evaluating and treating late effects is an important part of cancer survivorship care. Chemotherapy and radiation therapy can cause long-term side effects to the brain, spinal cord, and nerves. These include hearing loss from high doses of chemotherapy, especially drugs like cisplatin, increased risk of stroke from high doses of radiation to the brain.